Okay, so talking about lung cancer in general, lung cancer is still the most common cause of cancer deaths and is still one of the most common cancers. About more than 85% of lung cancer are related to tobacco, smoking. Unfortunately, lung cancer has a very high mortality rate unless it's diagnosed at an early stage. The symptoms of lung cancer are very non-specific, like cough, shortness of breath, weight loss. So usually the diagnosis of lung cancer is made at an advanced stage. About the screening of lung cancer, at this moment there is no official guidelines about the screening of lung cancer. However, there is a recent randomized trial that shows that the screening of high-risk patients, meaning patients who have smoked for prolonged periods of time, if we do low-dose radiation CAT scans, we may be able to detect lung masses or lung nodules at an early stage, and that may improve the overall survival of lung cancer. By screening or by any other means, a pulmonary nodule or a pulmonary mass is seen on an X-ray or on a CAT scan, the next step is see in what stage that nodule or that mass is. And to do so, there are several ways of doing that. One is surgical and one is by bronchoscopy. When we found a nodule or a mass on a CAT scan, many times the next step is to do a bronchoscopy to take a sample of that nodule to prove that is or that is not cancer. In the recent years, the advances in bronchoscopy have also made possible to take biopsies of pulmonary nodules that are less than 2 or 1 centimeter in size. The combination of advanced bronchoscopy include the use of an electromagnetic field where we can map that small nodule. Is like a GPS type of mapping, and after we found that nodule, we find the exact airway that will guide us to take a sample of that nodule. Also, there is a new technique called endobronchial ultrasound, where the bronchoscope has at the tip an ultrasound, and in that way we can see lymph nodes and we can see masses that are close to the patient's airway, and we can take real-time samples. The incidence of lung cancer is steady worldwide, unfortunately because of the epidemic of tobacco. We have patients that come from every part of Latin America, and with the diagnosis of a lung nodule of lung cancer that are here to take biopsies or to receive treatment, or advanced stage of lung cancer that we can use other techniques to have a better quality of life of the patient. So the most important message is do not smoke. In order to prevent lung cancer or many other type of cancers or cardiac problems, the most important single issue that you can do is to not smoke. Don't even start smoking, or if you smoke, stop smoking as soon as possible.